Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Chronic pain patients use comfort eating to cope. Study finds, break and number 148, about 2 out of 3 people in chronic pain regularly turn to chocolate, ice cream, salty snacks or other comfort foods to cope, a new study says. Break this raises their odds of gaining weight, which in turn can worsen pain and increase risk of future health problems, researchers said. Break and number 156, people who live with pain every day need to find ways of coping, and number 157, said senior researcher Toby Newton-John, head of the Graduate School of Health at the University of Technology Sydney in Australia. And number 156, we think about medication, physiotherapy or heat packs as pain management strategies, but we don't usually think about food in the same way. And number 157. Break Newton-John added in a news release that 2/3 of the study's sample said they turned to food at least once a fortnight when pain flared. And number 157. Break about 1 in 5 people around the world live with chronic pain. And number 148, pain that lasts 3 months or more, researchers said in background notes. Break for the new study, researchers surveyed 141 adults with chronic pain about their diets and food choices. Break results showed that fewer than 1 in 5 patients, 18%, never turn to comfort eating to deal with their chronic pain. Break more than 70% reported using food as a way of coping with pain at least 1 a month, and 64% at least once every 2 weeks. Break the main reasons for turning to comfort eating included. Break to have a pleasant experience, 52%, break to provide a distraction, 50%. Break to reduce emotions, 39%. Break and number 156, that was the somewhat unexpected finding, and number 157, researcher Amy Burton, a lecturer in clinical psychology at the University of Technology Sydney's Graduate School of Health, said in a news release. Break and number 156, comfort eating less than /speak. Speak wasn't just for the purpose of distraction or numbing negative feelings, although those were important too, and number 157, Burton said. And number 156, for many, eating comfort foods provided a nice experience in their day and something to look forward to. If you're living with pain all the time, that moment of pleasure becomes a pretty powerful motivator. And number 157. Break there also might be a biological explanation for comfort eating, although the study wasn't designed to look into that, Burton said. Break and number 156, research shows high-calorie foods can have a mild pain-relieving effect, and number 157, she said. And number 156, even in animal studies, rats in pain will seek out sugar. It seems it's not just psychological. It's possible that there is a real analgesic property to these foods as well. And number 157. Break however, this relief comes at a cost. Nearly 40% of study participants met the criteria for obesity. Break worse, food-driven relief can become part of a vicious cycle in which it worsens chronic pain, Newton-John warned. Break and number 156, in the short term, high-calorie food makes people feel better. It reduces pain symptoms and enhances pain tolerance, and number 157, he said. Break and number 156, long term, it can fuel weight gain and inflammation, which increases pressure on joints and makes pain worse, and that can trap people in a spiral that's very hard to break, and number 157, Newton-John added. Break these results indicate that dietary advice should be woven into pain management programs, to help people avoid using comfort eating as a means of dealing with pain, researchers said. Break and number 156, we usually teach skills like relaxation, stretching exercises or how to pace activities, but we rarely talk about food in this context, and number 157, Newton-John said. And number 156, this work shows we need to help people recognize if they're using food as a pain management tool and give them alternatives. And number 157. Break at the same time, people living with chronic pain don't deserve to be food shamed, he said. Break and number 156, managing daily pain is incredibly tough, and medication often only goes so far. It's understandable that people reach for something that feels good, and number 157, Newton-John said. And number 156, but awareness is key, both for clinicians and for patients, to /speak. Speak Cape this cycle. And number 157. Break the new study appears in the Journal of Clinical Psychology in Medical Settings. Break sources: University of Technology Sydney, news release, October 7, 2025. Journal of Clinical Psychology in Medical Settings, February 22, 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. Read this next: 700 plus CDC layoffs reversed amid backlash over cuts to disease response teams. Break and number 148, layoff notices to some 740 workers at the U.S. Centers for Disease Control and Prevention, CDC, have been rescinded. While personnel leading the Break ketogenic diet may protect against prenatal stress, study finds. Break and number 148, a high-fat, low-carbohydrate ketogenic keto diet may help protect young animals from the lasting effects of stress experienced before birth. New. Break: Joe Biden begins treatment for aggressive prostate cancer. Break and number 148, former President Joe Biden is now receiving radiation and hormone therapy to treat an aggressive form of prostate cancer, his office confirmed. Break: more news resources for MedWatch. Drug alerts: daily med news for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break: whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.